Today, we're talking about how to improve your skin using dermal fillers. Hi guys, so today I am going to show you a lovely lady whom we treated using quite a bit of hyaluronic acid dermal fillers, but most of it was actually used to improve her skin. So, you know, as you get older, you start to notice that you've got tiny little fine lines in the skin and the quality maybe isn't so good. Maybe it doesn't look as bright and as vibrant as it used to. Well, you can use hyaluronic acid directly inside the skin to kind of give it a supercharge, a super boost of water, which also makes you produce some of your own collagen as well. We use quite a few different types of hyaluronic acid, so I will go through that with you during the video, but let's take a look at her first. This is exactly what I was talking about here. So you see that area right there, just where the skin is looking a little bit crepey, and we've got these kind of fine vertical lines on the lip and these fine vertical lines and horizontal lines here as well. It's kind of generalized. I have a lot of people who don't like these smile lines here as well. But the thing is, guys, to treat those little lines, you kind of need to do a bit more than just pop a bit of filler underneath. You need to do something which is going to be treating the skin directly rather than just the shape of the face. Let's just look at the shape actually while we're here. We can see that, you see the eyebrow, quite a discrepancy there. On this brow, the tail of the brow and the head are about level. But on this one, you do have a slight up tilt there. Just generally, this one's a little bit lower. So it would be nice if we could try to raise that up slightly. We've got some volume loss as well in the temple on each side. And can you see right here, there's a little bit of excess skin above the eye. Not so much on this side, actually. We've got some little lines around the eye too on both sides, and nasolabial lines, obviously. What do you think of the general shape of the face? Pretty good. She was a bit of a grinder actually, so she did have an enlarged chewing muscle right here. And the chin is a tiny little bit flat. We've also got a chin crease right there as well. So again, let's try and make her face into a little bit more of a V shape. How did we do that? Okay, so first of all, we started using some Botox. We did the typical areas first, the forehead, the frown lines, and the crow's feet. I also did the lower face, so the mentalis and the DAO, the masseter, which is your chewing muscle. We then started by adding some radiesse on top of the cheek to start to take the face into a bit more of a V shape. I then put some Juvederm Vol Lift into the temple and also some Vol Lift in the base of the nose and the front part of the cheek also. So you can see there, we're just starting to get a bit of structure going on. The next thing was the chin, and we did the crease using radiesse again, using a cannula, and then the point of the chin using the radiesse. Because we'd managed to do all that, I had a look at the eyes. So what I'm trying to do here is use a cannula to tilt the eyebrow upwards, but also to fill out a bit more of that temple hollow. Remember guys, you could use hyaluronic acid pretty much anywhere on the face. There are very few spaces that you actually can't inject. Now we're gonna go to the lip using a cannula, and we're gonna use a needle just to pick off those two tubercles. So if you remember, in the lower lip, you're supposed to have 2 points, which are called the two tubercles. So there's one right here and one right here. And we need to maintain that if we ever do a lip augmentation. Otherwise, your lip winds up looking like a sausage, which is not cool. Then we're gonna go to the GK point. Remember, this is the GK point right here. It's the highest point of the Cupid's bow. We're using a very fine needle there just to pick off that point. Then we're gonna go ahead and put some Juvederm Vol Light in these vertical lip lines with a needle. The reason why we don't do that first is because it can make you look a bit like a monkey, which is not a good look. If you add volume here without adding volume in the lip, it tends to push the lip over, and then you can see less and less of the pink part of the lip, which honestly, it just doesn't look good. Doesn't look good at all. So you have to do the lip augmentation first, and then you can do the vertical lines, and then it looks really natural. Why are we doing it both with a needle and with a cannula? Well, it's because we're trying to do different things. We're using a cannula to kind of give a base to the upper lip. So to kind of get rid of any volume loss that's there. And then we're picking off the individual fine lines using a needle. Now we're gonna go and use a needle in the nose to mouth lines. And you can see I'm using a slightly different technique here. We kind of go in from one side and then deposit the filler directly in the nose to mouth line and then in from the other side, rather than chasing the line. I use this if a line is particularly difficult to get out, or if there's a big fold in the skin. You know me, I like to use an insulin needle in the central forehead, just find that it gives a bit more control. So we're doing this to improve the light refractive property of the forehead. So we've done the structural stuff now. We're gonna go ahead and do the skin improvement stuff. So I am basically just gonna throw a bucket of Profilo at this lady, including to the forehead. So you can see here, we're raising these bumps of Profilo. That is absolutely normal. So whenever you use this product, which is a sort of injectable moisturizer, it will raise a bump and then it will spread out underneath the surface of the skin, giving you a kind of lattice work underneath. I'm kind of just doing that everywhere on the face because that's really one of the main problems, is we need to improve her skin quality and her skin texture. To finish up, I'm gonna do something a little bit off the wall, which is her ears. So you can see I'm just putting some hyaluronic acid directly into the ear. This is an area which is, I don't know, I think it's a bit neglected. So we do the face, we do the neck, we miss the ears. And often people notice your ears because, especially ladies who wear jewelry, the whole point of wearing jewelry is to draw the eye and attention to that area. So you gotta do the ears, ladies. You have to. Okay, let's have a look at her before and afters. Ta-da! So very nice textural improvement, I think you will agree. You can see all these lines pretty much. They're still there, but really nowhere near as bad as they were before. We've really improved these fine lines on pretty good there, and the actual texture of the skin on the lip too is much better. You can see as well we've maintained her natural lip architecture, which means she's still got 1, 2, 3 tubercles, which is exactly what you're supposed to have. Let's go on and look at the eye area. So yeah, we've definitely improve those little lines around the eye and across the forehead, but she's kept the lines. So, just because you have a non-surgical treatment doesn't mean to say that you're suddenly gonna look like you've been rubbed all over with an eraser. They're still there. She still looks like her. I think the eyebrow looks better as well. Can you see the highest point of the eyebrow? The peak is different in the after picture because we have managed to just lift that up slightly. I just think in general, sort of the whole area looks a lot more slimmer, kind of a bit more of a V shape, which is quite nice. Should we have a look at her smiling? You can see she again still looks like her. She's kept her facial expression. See those lovely cheek apples? We still have them. They're in exactly the same place. These little lines which appear here on smiling, definitely a bit softer. And same thing for these lines just coming down here on each side. I don't know, I just think she looks a little bit brighter, a bit more rested. The vertical lines have been decreased, the little lines around the eye. And I don't know if it's my imagination, but I think she just looks a bit more even when she's smiling. It's in the before picture, it's almost like she's baring her teeth, and then in the after, not so much. It just looks a bit more rested. I think it's pretty nice. Okay guys, so that's all we've got time for today. I hope you enjoyed the video. If you've ever thought about having a non-surgical procedure, or if there's anything that you'd like to ask me, please just write something in the comment section below. Don't forget to subscribe to the channel, and I will see you here next week.